Morning, everyone. Morning. We are ready, we are willing, we are able to find a bipartisan path forward and reaching a spending agreement that actually keeps the government open, but meets the needs of the American people in terms of their health, their safety, and their economic well-being, related to lowering the high cost of living as opposed to allowing tens of millions of Americans to experience dramatically increased healthcare costs. What we will not do is support a partisan Republican spending bill that continues to gut the healthcare of the American people. Over the last several months, Republicans have created a healthcare crisis in the United States of America, largest cut to Medicaid in American history, triggering the possibility of a $536 billion cut to Medicare if Congress does not act because of what happened with the One Big Ugly Bill. Republicans have refused to extend the Affordable Care Act tax credits, and as a result of that, millions of working class Americans are going to experience skyrocketing premiums, copays, and deductibles at a time when America is already too expensive. Hospitals are closing. Nursing homes are closing. Community-based health centers are closing because of what Republicans have done in their One Big Ugly Bill. The Centers for Disease Control are under attack in the appropriation bill that Republicans have put forth in this month. The National Institute of Health under attack because of what Republicans have done in their appropriations bill this month. And they're limiting the ability of children and families to get vaccines. This is a five-alarm fire in terms of the Republican-caused healthcare crisis. And that's why Democrats are determined to turn things around. Questions?
If the White House today, you get some assurances that they're willing to negotiate on extending the Obamacare subsidies. If that happens, would you then be open to a clean CR for the next 7 weeks?
Our position in the spending bill that has been introduced by House and Senate Democrats is a permanent extension of the Affordable Care Act tax credits. Enough with the games that Republicans have been playing connected to the health care of the American people. And no one can trust their word on health care. Are you kidding me? These people have been trying to repeal and displace people off the Affordable Care Act since 2010. That's 15 years. And on behalf of the American people, we're supposed to simply take their word that they're willing to negotiate. The American people know that would be an unreasonable thing for us to do.
Why not negotiate?
What about Mr. Thank you. Good morning. Do you really think that the president is in a position and in a mood to negotiate? He canceled the meeting last week. Do you also anticipate that this could be one of these, yelling matches that we've seen in the White House Oval Office before, and you walk out and everybody looks worse after the meeting?
We've made clear that we are willing to find a bipartisan path forward on a spending bill negotiated by Democrats and Republicans. But it has to meet the needs of the American people. We're not going to simply go along to get along with a Republican bill that continues to gut the health care of everyday Americans who are already living with this Trump economy where costs aren't going down, but they're going up. Inflation is going up. Donald Trump and Republicans promised to lower the high cost of living on day one. That hasn't happened.
But you think he's ready
and now we're on the brink of tens of millions of Americans literally experiencing premiums that are going to increase by thousands of dollars a year. This is going to cause people to fall into medical bankruptcy. That's not acceptable in the wealthiest country in the history of the world?
Mr. President, one of my colleagues spoke with the president just yesterday. He basically said that unless you, as Democrats, back down off of your position, a shutdown is likely. Specifically, he said, I just don't know how we are going to solve this issue of Democrats. He says they're not interested in fraud, waste, and abuse. And then with respect to health care, he says that basically it's got to address immigration and border-related matters. Otherwise, it's just not acceptable to us. So can you specifically respond to that, and are you open to compromise?
We've said from the beginning that we're willing to find a bipartisan path forward, and our line in the sand is the bill has to help everyday Americans, not hurt everyday Americans. Let's be clear about what this group of people have done. This one big ugly bill that Republicans passed, they're telling the American people what they're all about. Largest cut to Medicaid in American history, ripping food from the mouths of hungry children, hungry seniors, and hungry veterans. And they did all of that to reward their billionaire donors with massive tax breaks. That's what Republicans have been all about in terms of governing this year. And we're not down with any of that. It's not complicated. So our view is, yeah, we'll find a bipartisan path forward to meet the needs of the American people, starting with health care and lowering the high cost of living, because we're in a health care crisis right now. Let me address the continued effort to try to misrepresent the Democratic position. In fact, Republicans are lying because they know they don't have the high ground. They have a weak position because they're trying to continue to hurt the American people. Federal law prohibits the expenditure of taxpayer dollars on providing health care to undocumented immigrants. Nowhere have Democrats suggested that we're interested in changing federal law. The question for the president is whether he's interested in protecting the health care of the American people.
Can you talk a little bit about your approach to the meeting today, given the fact that you've not met the president face-to-face like this before? And then secondly, the idea as you talk about a five-alarm fire, do you have a concern that if the government shuts down, it only makes the five-alarm fire worse?
Here's the thing. Republicans control the House and the Senate, and there's a Republican president. If the government shuts down, it's because Republicans want to shut the government down. We've been in a five-alarm fire since January 20th. Mass firings have occurred since January 20th. They've triggered an environment where costs are going up, not down, despite their promise to change that dynamic. All the things that make America the great country that we are actually under assault. And in this country, wealthiest country in the history of the world, our view is simple. If you work hard and play by the rules, you should be able to live the good life. That's what we're fighting to achieve. Good paying jobs, good housing, good health care, good education for your children, and a good retirement. And for millions of Americans, they're doing the first two things. They're working hard. They're playing by the rules, but they're unable to live the good life. And good health care is a big part of that American dream. Our approach, and Leader Schumer and I are in lockstep. House Democrats, Senate Democrats are in lockstep. We're heading into the meeting to have a good faith negotiation about landing the plane in a way that avoids a government shutdown, but does not continue the Republican assault on the health care of the American people.
Why not allow the typical appropriations process? I mean, what are Republicans going to get out of this in just 7 weeks of funding for a whole host of demands?
In terms of the typical appropriations process, what House Republicans have done is to continue the Republican assault on health care. A $1 billion plus cut that House Republicans are proposing with respect to the Centers for Disease Control. About a $450 million cut to the National Institute of Health. Republicans are trying to take vaccines away from children and families in this country. That's in their appropriations bill. That's their process that they're trying to jam down the throats of the American people. And Democrats are not interested in participating in the continued Republican assault to gut health care, period, full stop. We've been very clear about this for months. That's why we oppose the one big ugly bill. And that's why we believe that simply accepting the Republican plan to continue to assault and gut health care is unacceptable. Last question.
Republicans have co-opted a lot of your criticisms of them in the past as far as cutting off Head Start. They say that you're the ones that are trying to take food out of the mouths of women, low-income people, infants. Are you confident that Democrats, if the government shuts down, will continue to be able to convince the American people of your position that it is the Republicans that are shutting down the government when they're saying, hey, we're giving you what you want. You're the ones that are hurting the American people by shutting down the government?
The Republicans are trying to jam a spending bill down the throats of the American people that was a partisan spending bill that Democrats in the House strongly opposed in March because it hurt veterans, hurt children, hurt seniors, hurt housing affordability, hurt child care, and it hurt the health of the American people. That's why we opposed the partisan Republican spending bill in March. If the Republicans were interested in finding bipartisan common ground around a spending bill, then the baseline should actually be the bill that had strong bipartisan support in December, signed into law by President Joe Biden. Our position will continue to be clear in this meeting and as we communicate to the American people: cancel the cuts, lower the costs, save health care. Thank you, everyone.
Thank you.